If your child's pediatrician, family doctor, developmental pediatrician, or psychiatrist has recommended medication as part of the treatment for ADHD, we're going to share with you all you need to know.
When starting ADHD medication, we consider a child's age, weight, medical history, and how they're going to take that medication, whether it's going to be a liquid, a chewable pill, or a pill that they can swallow. It's important to remember that while medication is an essential part of ADHD management, it does not work in isolation, but rather as part of a comprehensive management strategy. Other important factors to consider include lifestyle modifications, eating a healthy diet, maintaining good sleep hygiene, adequate support at school, and counseling.
One of the first questions we get from many parents is, how do ADHD medications work? Well, with ADHD, brain chemicals, also known as neurotransmitters, primarily dopamine and norepinephrine, are not efficiently released into the areas of the brain that help us manage executive functioning, impulse control, activity levels, and emotional regulation. These medications work by helping the chemicals go where they need to, kind of like traffic control, allowing the brain signals to transmit more effectively.
When treating ADHD with medications, there are two options: stimulants and non-stimulants. What comes to everyone's mind when they think of ADHD meds are the stimulant medications, which include Ritalin and Adderall. These are the first-line medications and are most effective in targeting the inattention, hyperactivity, and impulsivity.
With stimulant medications, there are two main classes: methylphenidate-based medications, which include brands like Ritalin and Concerta, and amphetamine-based medications, which include brands like Adderall and Vyvanse. Both classes increase dopamine and norepinephrine levels in the brain, just in slightly different ways. They both help improve attention, activity levels, impulse control, and emotional dysregulation. Both classes of medications are effective in managing ADHD symptoms, but individuals may respond differently to each type, so it often involves some trial and error to find the right medication and dosage.
For stimulant medications, there are short-acting and long-acting versions. The short-acting version can last from 3 to 4 hours, and the long-acting can last anywhere between 6 to 12 hours. The type of medication that is used depends on how long we want the medication to last, keeping in mind a child's age, appetite, and sleep. Stimulant medications usually start working within 30 minutes to an hour. These medications stay at therapeutic levels for hours, not days. The good thing about this is that if there are negative effects noted, you just don't give another dose, and it's usually out of the child's system within the same day.
Common side effects with these medications include decreased appetite, which can lead to weight loss if not monitored, upset stomach and headache, especially if not taken with a meal or drinking enough water, increased heart rate, irritability, and difficulties with sleep if given too late in the day. In general, we start kids with the low dose, and if no side effects are noted, we increase the dose if needed to get maximum benefit.
The second type of ADHD medications are non-stimulants. They can be helpful when stimulants are not as effective, when there are concerns for poor weight gain, and in young children. They can also work well in combination with stimulant medications, as they generally last longer and have fewer side effects.
As with stimulant medications, there are two classes of non-stimulants. Alpha agonists. These include guanfacine and clonidine. We especially like guanfacine and consider starting these to help with hyperactivity, impulsivity, and emotional dysregulation. Both can make children tired when starting and can lower blood pressure. These do not usually negatively affect appetite or sleep, which is a plus. Selective norepinephrine reuptake inhibitors, or SNRIs. These include atomoxetine or Strattera and vilazoxine or Qelbree. These are in theory supposed to help with both ADHD and anxiety. However, they are still not first-line options, but good to consider when stimulants don't work out. This class can also affect appetite.
Non-stimulants do need to be given every day of the week. They also need more time to build up to therapeutic levels, usually taking a few weeks. So we prepare parents to expect it as compared to stimulant options.
We love working with kids with ADHD and are passionate about finding the right mix of strategies to help them thrive. It's incredibly rewarding to see how the right medication and support can boost not only school performance, but confidence and life at home. Many parents and kids say that they wish they had started sooner.
That pretty much covers everything about ADHD medications that we prescribe and what parents need to know about them. Just as you wouldn't withhold prescription glasses from a child who needs them, ADHD medications should also be approached with the same care and consideration. We hope you found this video helpful. Please like and share and provide comments or questions below. Thank you for watching.